to our so uh, first of all, we are not professional, so if we make any mistakes, please excuse us. So we wanted to thank Mr. Mustafa Kamal Ahmed for accepting our invitation for discussion about SMB. He got a lot of uh, he got a lot of license and certification from USA, Canada, and Saudi Arabia. As we are solely focused on molecular biology, we will try to keep our discussions on these topics. Um, so Mr. Ahmed got his ASCP SMB certification on June 2019. As you know, SMB started on 2018. He was number 4 person to get these certifications. To give some idea about him to our audience, Mr. Ahmed is like working as medical director at MK Laboratories. He has more than 14 years of experience with clinical lab. He secured his Bachelor's of Science uh, uh, on Chemistry and Biochemistry from Alexandria University on 2008, and he secured his Master's of Science on Biochemistry and Molecular Biology from Alexandria University on 2012. Today, we will focus fully in-depth discussions of ASCP SMB. So thank you so much for joining.
So thank you very much, Muhammad Abu Bakr, for inviting me. It's really my pleasure. I'd like to answer all your questions, give you my little experience about ASCP exams. So I hope this meeting will be beneficial for you and for all attendees. You can start, no problem.
Okay, thank you. At first, let's see some statistics. Some of we are very scared of seeing these statistics. So this is the statistics of 2018. So that's the year that started SMB. Uh, so if you see here, like only 2% got. Then
Uh,
2019.
yeah,
Oh,
I
sorry.
can
Yeah,
see screen. So
yeah, sure. You can see my screen, right?
no, I cannot see any screen.
Okay. Um, um, Everyone else can see my screen. Can you please? Uh,
Abu Bakr, I can see your screen. So your PowerPoint, I can see.
okay.
Oh, maybe it's my problem. So no problem. You can go ahead.
Uh,
Maybe just share it again. Sometimes it
okay.
works.
Yeah, sure. I'm gonna stop sharing and I will. Sorry for
Because
that.
he has joined later, so that could also be a thing, no?
Yeah, maybe. I'm gonna share that again. Let's see. Um, is it working right now?
No, unfortunately. Okay, no problem. Just go ahead. No problem.
Okay, sure. So, um, just to give an idea, so this is the like in 2018, 2% got the license, 1% like total among 33 persons, 31% failed, meaning 94% people failed. 2019, only 9% got. 2020, uh, only 15%, like not only this is not 15% or 19, it's the it is added like cumulative number. So if you see here in 2018, total taking 33, uh, like only 2% passed. Next year, 46, then 9% passed. Like in 2020, 53 a person take the exam, only 15% passed. And 2021, 69% take, but only 19%. So till 2021, I think according to ASCP website, only 19% um, got the certifications. So our question is like this 69 people who got the approval, is it till now or was it like on only 1 year? Meaning like how many people are taking this
Till now.
exam?
This is till now. The total certified number until now.
This is the 4 years, 4 years of
Yeah.
number. Okay. Our second question was so it's a demo of a like a summary of a subtest performance. So normally we know if somebody failed in MB or SMB, then they like they showed the score like to give an idea in which sector we need to focus for studies, something like that.
Yes,
So
sure.
yeah, so the question was like how they calculate it, like is it same as MB and do they calculate the score based on sections, or what is the minimum score one should get from each sections? And another question is like MB, IMB, SMB, ISMB. Same way calculations happens like regarding the percentage and subtest scores, like one person got molecular science 100 subtest score, molecular techniques 296 subtest scores,
So
laboratory operations 236. So it was an example, yeah.
so it is like any other ASCP certificate, any other calculation. No subsection uh, score is required. The total score required is 400.
Okay, got that. Like in total, if some person gets 400, it's fine. Got
Yes,
that.
but
Okay.
400 with specialist in molecular biology is something that is not easy at all. Okay, so a question uh, that you can got like you know that each question is scored from 1 to 9. So a question with a score of 7 in MB can give you can be score of 2 in SMB. For example, if I'm asking you uh, what is how can you and what is the equation for annealing temperature, and you are in MB exam, and you answer that you will calculate it from equation blah blah blah, and your answer is true, you got 7 degrees. But same question in SMB is 2 degree only.
Got that. I think like for SMB, it is more tough to like increase the points
Yes,
because there will be
it's
more harder
very
question.
it's a very tough. Actually, a specialist in molecular biology exam was not planned for ASCP, or ASCP was not allowed to offer it, because in order to work as a lab director uh, in molecular biology section in US, you have to have a American College of Medical Genetics ACMG certificate. Okay, but in molecular biology, uh, in order to get this certificate and work as a lab director, you have to study 3 more years then to pass the ACMG exam. But due to the less number of people or less number of candidates for ACMG, ASCP takes this step with the collaboration of ACMG, uh, and ACMG allow ASCP to offer a specialist in molecular biology exam with supervision of ACMG, and that's why the exam is very, very, very tough.
I think we just discussed, I think, few days ago with Dr. Muit about this ACMG and lab director things, and you are totally correct. It's a it needs like after PhD or after MD, somebody needs more experience to take that exam, and that's why I think this exam is now it makes more clear like
Yeah.
why it is very much difficult. Okay.
No, it's not typical. It's very, very hard to get the a specialist in molecular biology. And actually, I uh, I was number 4 to get the certificate, but now the exam is more tough than time that I got it.
For that. So we,
I'm
I think
not,
right now,
I'm not trying to, يعني, to
yeah, obviously, like
allow it,
we
but I'm just trying to tell you the truth.
Yeah, realistic. We have to be realistic because I think we are facing more of the problems, like real life problems regarding molecular biology. So one
I,
director should have knowledge.
as I speak with you, as my speech with you yesterday, the exam, 70% of the exam
Mhm.
is will you will not find answers in the books. Okay,
Mm,
so
got
you
that.
cannot, if you study hard, you will not pass the exam. But you need to work hard. You need to have hands-on experience
Mhm.
in all aspects of molecular biology, especially in sequencers, starting from, you need to know the background, the usage of each technology, the history of each technology, and the daily hands-on experience. So if you have the highest degree in molecular biology, even a PhD in molecular biology, you will not pass the exam if you don't have a hands-on work experience working in all techniques, but especially in Sanger, NGS, and when speaking to NGS, you have to have experience in Illumina technology, as well as on applied biosystems like ion torrent technology. You need even to read what's on the vials of the chemicals and to understand it. Okay, questions of the exam are all like 70% are all related to your hands-on. Even if you can, after going to the exam, uh, if you can recall some questions, if you go back to the books searching for the answers, you will not find it. Answers is in the lab, is on the bench.
Yes, you are correct. I think some other peoples also share the similar things. Like, uh, it is more of like realistic problem solving. It is more of like analytical things. I think you already answered a lot of my next questions. So I think let's skip some of the questions that I prepared for. Uh,
I'm so,
uh,
uh, I'm
yeah,
so
I think yeah, you already give me a lot of. Our next question was like, what will be your advice to a person who has exam within 2 weeks?
advice. What would be your advice to a person who has, sorry,
Who has exam, his SMB exams within 2 weeks?
2 weeks? If he has good experience on the bench, okay, he can go directly to the exam with no problem. But if he don't have this experience, no, he needs more and more practice on the lab, especially in the section of sequencing, uh, microbiology, and hereditary disorders. He needs to have he need to be really involved in every and each step, from pre-analytical, analytical, and post-analytical reporting. He need to understand every and each word written everywhere in the pre-analytical part, analytical part, and post-analytical report, even on the reagent vials.
Got that. Got that. I think it answers uh, our question. Uh, so I think you already answered. Our next question was like, what were the study materials you used for SMB? So normally in SMB website, they submitted some of the study materials, the textbooks. Some people said Lela Buckingham book of molecular diagnostic is very nice, and some said molecular pathology of Coleman. I think these are all common kind of books, but I think you already answered that these books plus all the bench works is required for this exam. So we
Lab
can.
baking perfect, but for molecular biology, not for specialist in molecular biology exam. For molecular biology exam, you'll find like 60% of the questions from Lila Buckingham, and for specialist of molecular biology, like 10% only.
Got that, got that. Or then we have to spend more and more time with the machines in real life, all the sequencing machines.
You need to spend all your time in front of your bench.
Got that. Uh, Okay, I think you already answered our next questions also. So I think I'm gonna quickly skip that portion. Um, you already answered these questions also. Okay, another question. I think it will make us for some of the peoples. So you said uh, we have to spend more and in bench work. Still, like, what which mistake you would fix if you can go back to 6 months before your exam?
uh, yeah, mistake I should fix. Go back. Uh, I can't find an answer for this question,
Yeah,
except I should be more involved in the work, in the lab work, not on reading books. Reading books is very good. It's a big knowledge. You
mhm,
will understand very important things, but you will not pass the exam.
got that. I think for us, those who are like in 2022, for what you are like again and again, that is more emphasized is working on bench. So our like this thing we need to focus on more. I think this is the one thing, one takeaway from today's discussion. I think that is very important. Um, I think you already answered that also. I think I can pass that.
Take your
Okay.
time, and hurry. Take your time.
Uh, yes. Our next question was like I think most of the people asking, and you simply I think one portion you already answered. But still, like our question is like according to your opinion, uh, why ASCP SMB number is low? Is it because of tough, or is it because of people do not know or do not want to take the SMB certification?
So it is because the eligibility is not easy. This is the first thing. Second thing, the exam is very hard. So if you have like 200 attendees now hearing me saying that the exam is very tough, it's very tough, very tough, a lot of them will escape, will not go for the exam. Uh, so eligibility is not easy. Eligibility needs many requirements, which is not easy for anyone. And if you are eligible, a lot of people will go for exam, but for the first time, if they fail, they will not try again because they will found themselves with first sorry, first few questions they don't know what is written. Actually, some people already go for the exam and come to me telling me we don't have any idea. Is this questions related to molecular biology? Is this questions is related to what we are doing in the lab? This is strange question. Actually, yes. The exam committee leader is from the ACMG, and his opinion is simply no one should take this certificate unless he is really, really qualified to pass this exam, and he has to prove us that he has the knowledge and experience to be a leader of a molecular biology lab in US.
That totally makes sense. That totally this was the discussion. Some of the lab they were like discussing why like ASCP is spending a lot of money and keeping one sections with SMB that there has like amount of people are very low. I think after these discussions, your answers gonna clarify all of their confusions regarding this issue, because obviously like one lab director should have capability to direct the lab. So uh,
Yes.
uh, our next question is, according to you, what are topics that you would suggest a SMB taking students reading again and again? I think uh, meaning like very high chance to forget uh, uh, during exams. For example, like I think you already like said that book knowledge or knowledge based questions will not gonna be there too much. It will be more of the realistic real life problem solving. So I think it will be good idea for one person to involve with all the managerial work, all the validation related work, all the troubleshooting work, all the problem solving work in the lab. I think that would be a good suggestions according to you.
Yes, and actually, you don't need to memorize any translocation. There is no questions about translocations, and there is no questions that need you to memorize anything. We will not ask you that CML is related to translocation 922 or whatever translocation.
Got
We
that.
This is not a questions for SMB. This can be a question for MB, but not for SMB. SMB, all questions is all like 100%, 100% of technical questions is related to um, your problem solving skills and your deep understanding of the technique. You need to really deep understand the technique, need understand the troubleshooting, need understand the false positivity, false negativity, the reporting. It's nothing related to memorization at all.
Got that. Got that. I think it answers our questions. Now we right now I think know some of the things. But our next question was a little bit different. It is like, what is the disadvantage you're gonna say of taking ASCP SMB? Meaning, like to elaborate the questions, like for some people who gonna spend a lot of time to get this certification, uh, uh, what kind of like like if we think about the loss benefit ratio, like uh, uh, is it a advantageous or is there has any disadvantage of taking ASCP SMB exam?
There is no disadvantage actually. The only disadvantage
Yeah.
is the stress that will be applied on you until you take the certificate. It's only the psychiatric stress only, but really it's a very prestigious certificate that really proves that you are really unique. You are really have experience and a good education.
Yes, I think that's correct. Like, who gonna pass this after all that answering all that tough questions? I think they have some knowledge about in-depth knowledge about this. Our next question is like, after that much hard work, when you saw pass, how were your feelings? Meaning, I think this thing gonna inspire a lot of people, which is like, if you want to add benefits of taking the SMB exam, benefits in general, like not only financial but also everyday life work or understanding. Please share with us. Like one thing you already said, like this means this proves one person has ability to direct one lab. Uh, uh, and
So
also to prepare this for exam also I think it's gonna help one persons to do their job better, like is you will agree with that, like it will help one persons to work more, take more responsibilities in the lab.
yes, sure. Look, for me personally, I have passed uh, five ASCP exams. So
Mm.
SMB was not the only or the first one. So, but uh, during taking all the previous exams, I was yeah, pretty sure that I will pass because questions uh, is not hard or uh, I can feel that I will pass the exam because yes, I know these questions. I'm familiar with it, so I am prepared very well. So I will pass the exam before saying submit. I'm sure like I will pass. But for a specialist in molecular biology, I was really no, this not happening.
Oh my God.
Actually, usually I finish all the ASB exams before the time. Okay,
Mhm, mhm.
but for SMB exam, no, the time close on me like in the last two questions. I did not. Um, I did not see it actually because the time already closed on me, and I was very, very. Uh, it's a very unusual experience for me because questions are strange, are really hard. Uh, I need to recall stories that happens inside the lab. Yeah, I see this word, but where I cannot really recall. I see these words on a label or something, but it was not related to a test, specific test, or it was not related to a specific company. So SMB was really uh, unique experience for me. So once the questions already done, sorry, the time already passed. I was really scared. I don't at this time. I don't even have the courage to look at the screen to see if I passed or no. But fortunately, I passed. So it was really very good for me. And during the next ASCP annual meeting, the ASCP president invited me and told me that you are the first one to pass the exam from the first time. So it was really pleasure that I can do it. Yeah, and it's really prestigious. It's really you can make a lot of yeah, a lot of benefits because there is no one like you. At this time, I'm number four in the world. Okay, and the number one and two is someone somehow related to the ACB or affiliated to ACB. So I'm number two in the world. Sorry, number one and two is related to the ACMG. So it's uh, not real experience. So I'm number two in the world. You feel like it's great honor uh, when you apply for a job or something like that. Actually, I didn't apply, but I see a lot of emails coming to me if I want to work with them or something. Uh, at this moment, I don't want, so I apologize for that. But it was very good experience. You will like it. Once you are certified, you will like it.
I think from this answer, it is clear to everyone. I think it will clear everyone's that obviously this certification is very prestigious and it will help everyone to go for their dream, to take the responsibilities they wanted to take, and it will prove to all institutions that they are capable to work. But the roller coaster emotions that you just shared with us, because when I saw your credentials, all the you have a lot of, as you said, a lot of certifications from different institutions, not only ASCP, and you have a lot of experience. So still, you are saying, like you take all the times from ASCP. So I think it's gonna give us our audience like how difficult is the exam, and uh, uh, a lot of our like members, they took the exams, and also the thing that you just shared, like several times people take to pass this exam. I think I can relate to that because I have seen some people they could not do that. Still, they had a lot of experience, but they could not. And also, like these emotions, like the after passing the exam, the feelings. I think as you said, it is worth it. Like all the hard work, it's worth it to see the pass.
Yeah.
Our next question is uh, okay. So this is one interesting questions for us. Like all of us who are here, we like more or less we're gonna spend our rest of our life with clinical lab or lab related work. So, do you want to change anything, or you think if it changes in lab industry, it will be beneficial for a lot of people?
Change anything, it will be beneficial to a lot of people. Actually, the lab industry or the lab itself is responsible or the backbone for all the advancements that happen in all areas of the medical field. So all specialties are working in close contact with the lab, and they cannot work without the lab. So I don't think that uh, lab has to change anything. Only lab has to defend his people and has to educate more people, or educate his people to help achieving more and more advancement in the medical field. So the lab is currently very, very nice. All other medical specialties rely on the lab, and the lab is a backbone of the medical industry, and it should be stay like that by educating his people more
I
and
think, yeah, you are correct. To give an context like of these questions, you are correct. Like the lab should defend their people because I think the pressure. I think I added these questions maybe, but as you already discussed, I can just add here. Our moderators, those who gonna like be here, but they just called urgent call from their clinical lab, and in this Sunday, which is weekend, they have to go and they have to do some work. So more people, if a lab industry can attract, and more talented people can attract, because we need more and more co-worker. Uh, Otherwise, sometimes it gets very difficult, I think. So, to get our next question is regarding um, I think you somehow answered the questions, but still, like some of our members failed in ASCP like MB or SMB exams. What suggestions will you give them? As we know, it is very tough feelings. Like after seeing the fail in the screen, and they said, like then after like I think 3 or 4 days, they send the score that okay, you got this, and these sections you should like improve or something like this. So uh, to cope up with these feelings or these emotions, what will be your suggestions to
so
them?
it is not an end of the world. So MB is an easy exam. It
Mhm.
needs more study. Just I think MB questions is all on the websites, all in the internet. So he will need just to track some of these questions, find the real answer, correct answer from the books, and not relying on the answers submitted on the websites. Uh, MB is not an tough exam. It's already designed to be a start for starting your career in molecular biology lab. So it needs just a good study. Lila Buckingham is perfect. It contains 90% of the technical questions. 90% of the technical questions. So if he go through Lila Buckingham book once more, he will pass definitely. Uh, SMB exam needs some real attention to the lab, especially to the technical work. If you do not pass the exam or your score is less than 300, please take a rest.
Yes,
Be
I
more
think
involved. Yeah,
I
yeah.
think
Be more involved inside the lab.
yes.
Yeah, to be more involved inside the lab.
Uh,
This is the key by which you will pass the exam. But if you study all the books, if you just memorize it all, this will not help. Trust me. If you have the highest molecular biology or the latest molecular biology PhD, this is not gonna help.
got that, got that. I think it's gonna help some of our members because some of our members, they suggested like they want to take it maybe within 1 year or 6 months, or somebody who took, like some of them who took and could not score well. So I think this like that answer that you gave, it will be very much helpful for them to reconsider like how should they prepare for this exam. And yeah, I think you were correct, like as you
They
are
know
always.
them questions, and they have the internet and they have the books. They
Mhm.
will not find the answers.
I think it makes sense. This is like one of our professor always says, like these kind of things, like analytical things that needs real life experience to solve some questions. I think it is more like we need to spend more and more in the lab. Yeah.
Nah. Okay.
Um, I think our next question is little bit different. Like, what change are you expecting, or how it will look within 5 to 10 years in molecular biology lab industry? Like, like to extend these questions, like any advice for future entrepreneur, because there has like some of the I know some of the scientists, like molecular biology scientists, they have planned to open a lab, or like because it's expanding. Like CRISPR-Cas9, we know genome editing, we know sequencing is getting more extended. And connected question is, which technology in the lab industry are you excited about? Like future technology, you are excited about more.
So NGS is my perfect excitement. So NGS has a lot to do still. Still, we don't benefit uh, from what we can do from, yeah, what we get benefit from this technology. So NGS is my best thing for future. You can, if you have the resources, you can play with NGS. You can play and you can explore. So molecular biology, so NGS and bioinformatics is really, really, really uh, advantages for all of us. We do not understand how can we benefit from this until now.
That got that. I think I can relate that because as we are living in New York, New York is, I think people can say it's a very like updated city, or still like it has in whole New York, it has around I think 52 lab that has the permissions from New York State to work with this molecular biology. So there has like millions of people living here. So as you said, I think we need to expand more. We need to like people are all like knowing, they know that, and the cost of NGS is getting reduced drastically, and the more it is affordable to people for like detecting cancer or any other genetic diseases. But still, like I think it has a lot to go. And as you said, within 5 to 10 years, it's gonna drastically, it's gonna change a lot. And NGS is obviously a very nice and interesting technology. So
Yes.
uh, our these questions, I think you little bit of touch this questions answer. Our next question is like a lot of lab personnel, as I just told you, like technologists, technicians, supervisor, manager, etc. burns out of with work, like maybe employee shortage or not enough people getting the license to work, or they're like calculating the cost benefits ratio, meaning the hard work and the benefits they're gonna get. Like what advice will you give them, or how to work life and study balance according to you?
So I sorry I didn't get the questions. The
S-
internet is interrupted, so I can read it.
yeah,
Screen
yeah.
is shared. So a lot of personnel, okay, burns out with work. Okay, maybe employee shortage or not enough people get license. What will you give them? How to work life and study balance? So I'm the bad person to answer this because I cannot even qualify or really justify this balance for myself. So
Okay, I think,
I'm
but any advice
4 hours.
to not burn out?
I'm working 24 hours, so I can. I'm the I'm the worst one in the on this planet to give you this advice.
But I think you will be a motivational or inspirational person. I think to see you as working hard, I think some people see Elon Musk as that like that person spends a lot of time working to building up something like to do some service to help people. I think yeah, at least you will be a motivational person to be with, to work with. I
Thank,
think so. That's it.
thank you. Really, I'm working 24 hours, so I'm not that one who can give advice about life balance, life study, and work balance. So,
Okay. Our next question is like, okay, so I think we are almost finishing our time. So after that, we will get, I think some of the people already answered. I could not get the time to check, but we will check the chat. But our last question is like, in future, if we want to connect with other SMB, can you please help us like to like you already answered a lot of questions, but it's still like we want to just discuss more so that getting the perspective, like you have some perspective as a like as you said you are fourth, but it's still like to second person who is outside of ACMG, meaning like obviously it's a very prestigious or like to get your perspective and to any persons if you know just if you can we want to like formally invite them. It is totally up to them if they want to discuss with us or they want to take our invitation, accept our invitation, it's fine, but that was our humble request, like if you can just refer us to any persons who want to discuss with us, because we are like the we think our members they will be the future because they are spending their whole life working in clinical lab. So getting some experience from any people, those who are our seniors, those who already working for a long time, who are SMB, can give us some of the experience, some of the like their real life experience they wanted to share with us regarding the clinical lab and their experience. As you said, it's a prestigious thing. I think the more and more people gonna know that, it will be helpful to get this. So it was our humble request. I think uh, that makes our sessions finished. So thank you so much. I think I can quickly uh, take some of the questions from chat. Um, so let's see. Uh, some person
I have a
talking with.
question. Sorry, I just
Yeah,
wanted
yeah,
to
yeah, sure, sure.
ask something. First of all, I would like to thank you for organizing it and thank our guest that he has really provided very holistic approach and a lot of information that was not, I couldn't find it anywhere else in websites and a lot of study groups. So that has really helped. Thank you so much, Dr. Mustafa Kamal. I have a question. So I'm basically a researcher. So I have clinical lab experience, but it's around 2 years. So I would be qualified for the exam. But um, after what I have listened to your discussion and everything, what would be your suggestion for us researcher to go for the test? Because we do work with the techniques, but I think that is a bit different than clinical techniques, right?
yeah, it's hello. Sorry, I can't see your name.
Yeah, it's Amna here, so Amna Mahmood. It's Amna here.
I'm not here.
She's
Okay.
to give our sorry, I did not introduce our participants. I'm so sorry. So this is Dr. Mahmoud. She is a assistant professor, if I'm not wrong, from Germany. And please continue your answer.
Okay. So thank you very much for your questions. Actually, it is my pleasure to be with you. Uh, to be honest, um, you may know that I have some um, knowledge about people who already passed the exam. Okay, and to tell you that none of the people who pass the exams are came from research background. None of them. Okay, all are currently working in the lab, and no one passed the exam from first time except two. Okay.
Okay.
Um, the exam is supervised by the American College of Medical Genetics. Okay.
Okay.
The American College of Medical Genetics is an organization that rely on the serving clinical clinical laboratories, not research laboratories. I understand that based on the eligibility, you are eligible, okay? But you will face a lot of questions that is related to the patient and medical or clinical situation. I understand that other questions will be related to the lab, the technique, and you may be better than me in answering it because you are working in research. But working in research in a certain situation or under a certain title will not qualify you for to go deep in the medical and clinical situation of the patient and will not give you the depth understanding of clinical diseases or other clinical diseases. So my advice to you, you should be attached by anyhow, it's up to you, to a clinical lab or a medical lab, even as a trainee, even as a trainee. So you will go deep into the pre-analytical, analytical, and post-analytical and reporting, which is reporting of the patient results. Because without that, you will not be able to answer many of the questions that's already in the current exam.
Okay.
You need to be attached to a lab. Try to do it by any time, even it's a part-time, if it's even it's 2 to 3 hours per day, even it's like 10 hours a week or something like that. You need to see a lab. You need to go through the process of the lab. The process of research is way different of the process of the lab. It's really different. Okay, so from ordering the test, from the clinical picture of the patient, from the recommended panel that you will recommend, you or other will recommend to the patient, to the analytical part, which technique you are going to use and why you are going to use that technique, why you are why you will do that panel and not that panel, how you proceed, what is the follow-up test you will add, will you confirm the mutation by other means or you don't need to do that, and the bioinformatic part and what the bioinformatic will tell you, will give you what is the final picture. Is it really related to the patient clinical situation? How to avoid that, to avoid having such situation in future patients? What is the troubleshooting you face? All that is not in the research.
True.
This is just clinical lab.
Yeah.
And to be honest, like you will lose like 25% of the exam if you are not attached to the lab.
Okay. Thank you so much. That was very comprehensive. And yeah, I mean, I was also expecting something like that after the discussion, that I should somehow get the experience of clinical labs. Yeah, but having a full-time job is difficult to find thing. But yeah, thank you so much. That was very helpful. I have another question. Our moderator has given us that we can ask 3 questions, so I will just ask 2 questions. How many years of experience did you have before taking this exam? I mean, being second in the world and only 15 has passed, that's a big position on its own. So how many experience did you have, and what did help you to get that in the first try?
Okay, so I will let you know. So I'm graduated in 2008, but I start working in 2006, 2 years before graduating. Okay, in a nearby hospital near my house. So it is very, very um, something that I really like to work in a lab. So I was working 8 hours. This is formally, but usually I stay 16 hours.
Wow.
Until now, I do the same. And now I own a lab and I'm working as a medical lab for another lab.
Oh,
Okay.
that's great.
And I'm working 24 hours. I'm with you now and I'm receiving calls. Even we are in a vacation now, but I'm receiving calls. So my actual experience in clinical labs start with just normal core lab, which is chemistry, hematology, whatever, until 2000 and from 2006 to 2009 and sorry 2010. Then 2000, at 2010, I start molecular biology. So I start working with PCR, with all techniques related to PCR, conventional, real-time, reverse hybridization, and all that. And then I move to sequencing, start with Sanger, and to the latest thing now I'm working in NGS and microarray, even in cytogenetics, because that area really interests me. So I'm working from 2010 until now in molecular biology. Just last year, I'm currently managing the lab. So I'm not involving a lot in the technical work currently, but I passed the exam because I was preparing for a very, very tough exam also, which is the CSMLS from Canadian Society of Medical Laboratory Science.
Wow.
Because yes, I was preparing for both at the same time. For the CG ASCP, which is cytogenetics, and SMB, specialist in molecular biology, and CG, which is clinical genetics from the Canadian Society of Medical Laboratory Science. So I, I expect that it's all cytogenetics and it's all molecular, and I can get 3 certificates, which is perfect for me. So I can prepare for all of them. So, and it all went perfect, alhamdulillah. Yani, I passed it, and I explained to you that I was not expecting to pass the SMB. Usually, usually during all my previous exams, I finish before the time, and I don't like to review my questions. I just click on the right answers until I finish the questions and then submit the answers. So for a specialist in molecular biology, no, it was not the case at all, because I found that the exam questions are really speaking with my deep mind. So it is not an easy thing. You need to recall things that really is not easy to recall.
Okay.
It's not something related to memorization, but it's something that need you to have your mind present and active, and your hands-on experience is the real key for this exam.
Okay. Okay. Thank you so much. If you don't mind, I will send you a request on LinkedIn because I want to be connected with you, and somehow maybe in 2 years I will take the exam and then maybe I will get back to you. So thank you so much, Dr.
With
Kamal.
pleasure.
Yeah, thank you.
Okay, sure. I will also can give you his email address so you guys can connect and share your knowledge with each other. I think it will be very nice. I will not gonna take much time. I'm gonna quickly go to another questions. It was asked by Miss Kelly Anderson to give you a background. Miss Kelly is a program director of a college. Also, she is working in, I think, managing another lab, and also she is doing lab three jobs, and then still she connected with us. So thank you, Miss Kelly Anderson. So her question is like, what advice would you give to someone that only has experience in one platform, for example Illumina? So you her another question is like, read papers about the other platform.
No, she should has real hands-on experience on other platform.
It is more of like a real life experience. So I think it answered.
Yeah,
And another question she asked is like, does the SMB go into bioinformatics?
no, it does not go to into bioinformatics, but the only information that you need to know is there is something called bioinformatics, and there is benefits of bioinformatics, and what is the benefits, what is the role in bioinformatics in the lab. That's it.
Or that to connection, like how bioinformatics helping molecular
Yeah,
biology or sequencing.
sure.
Got that. Dr. Mahmoud asked another questions. I think, what are his your suggestions for management related questions?
For management questions, um, management questions is not that.
I think I can add little bit with this. Like, so we know like in USA, New York State has some of the rules and regulations. Suppose New Jersey has some of rules and regulations. So different state has some of the rules and regulations. Maybe it is different from like another country. Like, but SMB is like worldwide. So they focus on this kind of like regional rules and regulations of management, or is it kind of like they focused on the worldwide?
No, it's general. It's more general, but you will not find a lot of management questions like something related, maybe two questions related to the HR, maybe related to the technologist behavior and how you report that. Yeah, it's a very, very easy questions. Anyone can answer it, even if you don't have idea about the management by common sense.
Got that. So, I just wanted to thank you again to give your, I think I took a lot of your time. Really sorry. I think you just said, I can feel you, like you are working 24 hours and still give us some time. I was stubborn to get your time. I think all of our participants, if you see my messaging with Mr. Ahmed, like I was like, can you please give us little bit of time? And at the end, he has gave us a lot of time. I think we exceeded our
No,
prior
my
thing.
pleasure. Feel free if you have any other questions. I'm with you. Feel free, no problem.
Okay, thank you so much, and all of our participants. I also thank you. I do not want to take any more times. I wanted to thank you and thank you for joining. And I can share all of you